Hey, what's up YouTube? My name is Jimmy and welcome to my channel, Envisage. On today's lesson, we will discuss the clinical manifestation of liver, as well as the treatment option for those clinical manifestations. We will utilize the water treatment facility to envision the liver. The liver itself can function both as a production of protein, as well as a means to metabolize or detoxifying an agent. The production of protein include, but are not limited to, clotting factors, oncotic protein, as well as bile. Detoxification of agents include a two-step process, phase 1 and a phase 2 metabolism. Phase 1 metabolism includes the conversion of a lipophilic compound to a more polar, such by adding a nitrogen or oxygen. Phase 2 metabolism includes adding a hydrophilic molecule that are bigger in nature to further the transformation process to increase its polarity, so that eventually the compound may be eliminated by the kidneys. Utilizing the circulatory flow diagram, we can understand the normal flow of the oxygenated blood. From the diagram, we can see that the oxygenated blood moves from the stomach to the liver via the hepatic portal vein. There are, however, two venule beds located in this circulatory system. Venule beds are exposed to less pressure due to the lack of endothelial cells, unlike the artery. So as a result of narrowing of blood drainage system in the liver through either excess alcohol intake, medication causes, or fatty liver, the pressure in the liver builds up that causes the backflow of the fluid. This in turn causes all the clinical manifestation that can be seen later down the line. Let's take a look at the different clinical manifestation of the liver. We can separate the clinical manifestation into three different components: the detoxification, the production of proteins, as well as the structural physiology. Let's first explore the detoxification. So in the detoxification, because it's the liver's inability to conjugate bilirubin, there's a buildup of bilirubin which causes jaundice. The color of bilirubin in nature is yellow, and hence a lot of patients with jaundice usually have a yellow complexion. Next is hepatic encephalopathy. The inability for the liver to process its toxins such as ammonia builds up a lot of the excess ammonia in the body, which causes the patient to become confused. The production of proteins. So the liver makes bile. So if the liver is damaged, it can no longer produce bile, or to a lesser extent, which increases the chance of cholestasis. The liver also makes the clotting factors. So if there are no more clotting factor, then if we potentially get hit, and then we're likely to bruise easier. And thirdly, our liver makes oncotic proteins. These oncotic proteins hold all the fluid in the vasculature. So if we don't make enough oncotic proteins, such as albumin, then we lose some of these potential fluid in the vasculature. And this could, as a result, form edema, ascites, and further complication of ascites is spontaneous bacterial peritonitis. And finally, we have 25-OHD3. 25-OHD3 is a precursor of the active form of vitamin D. So if we don't have that, then we can't absorb calcium. And therefore, these patients who do have these liver damage are more prone to have osteoporosis. In the structural physiology component, due to the increased pressure in the portal vein, there is a backup of fluid, which leads to an increase in pressure, known as portal hypertension. And if the pressure is high enough, some of these vessels may be popped, and this is known as variceal bleeding. And some of the clinical manifestation on our skin that may be seen with patients who have high portal hypertension are what's known as spider angiomas. And the other two clinical manifestation usually happens at the end liver stage disease. Those two clinical manifestations are hepatopulmonary and hepatorenal. If we follow the circulatory pathway, we can actually see that if there is a highly buildup of pressure, these pressure will backflow into the stomach, as well as potentially all the way back into the lungs. And these are the clinical manifestation that happens due to the increase in pressure. For the final component, we will utilize the water treatment facility to help us understand the clinical manifestation as well as the drug associated with those clinical manifestations. Firstly, the water treatment facility is a biological filter. Biological filter is the acronym of the symptoms of the liver. B for bruising, I for icterus or jaundice, F for fatigue, I for itchy skin, T for third spacing. The other symptoms that are associated with the liver symptoms are variceal bleeding, portal hypertension, ascites, as well as hepatic encephalopathy. The acronym for the pharmacological therapy component consists of vessel burst open. So think about the pipes within a water treatment process facility that is too high pressurized or it bursts open. So V, think about variceal, burst, think about bleeding, and open, think about octreotide. Pressure critically increases. So pressure, think about portal hypertension. Critically, C for corag, and then increases, I for indurel. And so when these pressure increases, there is some spillage of this fluid. So a fluid seepage, think about ascites. So F for furosemide, and seepage, S for spironolactone. So in order to help lower nitrogen ratio, think about hepatic encephalopathy. So lower nitrogen ratio. L for lactulose, N for neomycin, and finally R for rifamycin. Thank you for watching. Please comment below and let me know what other videos you'd like to see next. As always, let's continue to empower a different way to achieving success. I'll see you guys in the next one.